Are you curious to know about the various uses and potential side effects of midazolam? In this video, we will provide you with comprehensive information on midazolam, a medication commonly used in medical settings. Midazolam is a central nervous system depressant that falls under the category of benzodiazepines. It is primarily used for anesthesia and sedation purposes before surgical procedures or medical interventions. Additionally, midazolam is also prescribed for the treatment of seizures and anxiety disorders. Common uses of midazolam. Midazolam has a wide range of applications in the medical field. One of its most common uses is as a pre-anesthetic medication. Before undergoing surgery, patients are often given midazolam to induce relaxation and reduce anxiety. The sedative properties of midazolam help patients feel calm and at ease before the procedure begins. Another important use of midazolam is in the treatment of seizures. It is often administered to patients who experience prolonged or recurrent seizures. Midazolam works by suppressing excessive electrical activity in the brain, thus helping to prevent further seizures and promote a state of calmness. In addition to its anesthetic and anticonvulsant properties, midazolam is also utilized for sedation purposes in various medical procedures. It is commonly used during endoscopies, dental procedures, and minor surgeries to help patients relax and remain comfortable throughout the procedure. Midazolam can also be prescribed for the management of anxiety disorders. It is particularly effective in treating acute anxiety or panic attacks. The calming effect of midazolam helps to alleviate symptoms of anxiety such as restlessness, racing thoughts, and rapid heartbeat. Overall, midazolam plays a crucial role in the medical field by providing sedation, anesthesia, and seizure control, as well as helping patients manage anxiety. Advantages of using midazolam. One of the key advantages of using midazolam is its fast-acting nature. When administered intravenously or through other routes, midazolam quickly enters the bloodstream and reaches the brain, producing a rapid sedative effect. This is particularly beneficial in emergency situations where immediate sedation is required. Furthermore, midazolam has a short duration of action, which means that its effects wear off relatively quickly. This allows for better control and adjustment of sedation levels during medical procedures. It also reduces the risk of prolonged sedation and ensures a smoother recovery for patients. Another advantage of midazolam is its versatility in terms of administration methods. It can be given orally, intravenously, intramuscularly, and even as a nasal spray. This flexibility allows healthcare professionals to choose the most appropriate route based on the patient's condition and the desired level of sedation. Additionally, midazolam has a wide safety margin, meaning that it can be used in various age groups, including children and the elderly. Its predictable pharmacokinetics and well-established dosing guidelines make it a reliable choice for healthcare providers. Potential side effects of midazolam. While midazolam offers many benefits, it is important to be aware of the potential side effects that may accompany its usage. Common side effects include drowsiness, dizziness, and nausea. These effects are usually mild and transient, resolving once the medication is metabolized and eliminated from the body. In some cases, more serious side effects may occur, although they are rare. These can include respiratory depression, hypotension, low blood pressure, and allergic reactions. It is crucial to monitor patients closely during the administration of midazolam to promptly identify and manage any adverse reactions. Another consideration is the potential for midazolam to cause temporary amnesia. This can be advantageous during medical procedures where patients may prefer not to remember the details, but it can also be disorienting for some individuals. It is important to discuss any concerns or preferences related to memory loss with your healthcare provider before receiving midazolam. Dosage guidelines for midazolam. The dosage of midazolam varies depending on the patient's age, medical condition, and the intended purpose. It is crucial to follow the prescribed dosage and not to exceed it. The dosage can be adjusted based on individual factors such as weight, liver function, and other medications being taken concurrently. For pre-anesthetic use, the typical adult dose ranges from 2 to 5 milligrams, either administered intravenously or intramuscularly. The dosage for pediatric patients is weight-based and carefully calculated by the healthcare provider. It is important to note that the dosage should be tailored to the specific needs of each patient and should be administered under the supervision of a healthcare professional. Risks and precautions associated with midazolam use. While midazolam is generally safe when used as directed, there are some risks and precautions to consider. Midazolam should not be used in individuals with a known hypersensitivity or allergy to benzodiazepines. It should also be used with caution in patients with respiratory disorders, liver impairment, or a history of substance abuse. Midazolam can interact with other medications, particularly other central nervous system depressants such as opioids and alcohol. These interactions can potentiate sedation and respiratory depression, leading to serious complications. It is important to inform your healthcare provider about all the medications you are taking to minimize the risk of drug interactions. Pregnant women should consult with their healthcare provider before using midazolam, as its safety during pregnancy has not been definitively established. Similarly, breastfeeding mothers should exercise caution, as midazolam may pass into breast milk and affect the nursing infant. Midazolam versus other sedatives, a comparison. Midazolam is just one of many sedative options available in the medical field. It is often compared to other benzodiazepines such as diazepam and lorazepam, as well as other sedative agents like propofol and ketamine. Compared to diazepam and lorazepam, midazolam has a faster onset of action and shorter duration of action. This makes it particularly useful for procedures that require rapid sedation and a shorter recovery period. The choice between these medications often depends on the specific needs of the patient and the preferences of the healthcare provider. In comparison to propofol and ketamine, midazolam has a lower risk of cardiovascular and respiratory side effects. It is generally considered safer in patients with compromised heart or lung function. However, the choice of sedative agent depends on multiple factors, including the procedure being performed, the patient's medical history, and the healthcare provider's expertise. Midazolam administration methods. As mentioned earlier, midazolam can be administered through various routes depending on the situation and desired level of sedation. The most common routes of administration include oral, intravenous, intramuscular, and nasal. Oral administration of midazolam is typically in the form of tablets or liquid solution. It is commonly used for pre-procedural sedation or for the management of anxiety disorders. The onset of action is slower compared to intravenous administration, usually taking around 30 to 60 minutes to produce the desired sedative effects. Intravenous administration of midazolam offers the advantage of rapid onset, making it ideal for emergency situations or procedures that require immediate sedation. Intravenous midazolam is typically administered by healthcare professionals who are experienced in its use. The dosage is carefully calculated based on the patient's weight, medical condition, and the desired level of sedation. Intramuscular administration of midazolam is an alternative to intravenous administration when venous access is difficult or not feasible. The medication is injected into a muscle, typically the deltoid or gluteal region. The onset of action is slightly slower compared to intravenous administration, but still relatively fast. Nasal administration of midazolam is a non-invasive alternative that is particularly useful in pediatric patients or individuals with a fear of needles. It involves spraying a predetermined dosage of midazolam into each nostril using a specialized nasal spray device. The medication is absorbed through the nasal mucosa and enters the bloodstream, producing the desired sedative effects. Midazolam in pediatric patients. Midazolam is commonly used in pediatric patients for sedation purposes during medical procedures. It is particularly advantageous due to its fast-acting nature and versatility in administration methods. When used in pediatric patients, the dosage of midazolam is carefully calculated based on the child's weight and age. The goal is to achieve the desired level of sedation while minimizing the risk of adverse effects. Healthcare providers who specialize in pediatric care are experienced in determining the appropriate dosage and monitoring the child closely throughout the procedure. It is important to note that midazolam should only be administered to pediatric patients under the supervision of trained healthcare professionals. Parents and caregivers should follow the instructions provided by the healthcare provider and report any concerns or side effects immediately. Conclusion: is midazolam right for you? Midazolam is a versatile medication that is widely used for anesthesia, sedation, and the treatment of seizures and anxiety disorders. Its fast-acting nature, short duration of action, and wide safety margin make it a reliable choice in medical settings. If you are scheduled for a surgical procedure, experiencing seizures, or struggling with anxiety, midazolam may be an appropriate option for you. However, it is important to discuss your specific needs and medical history with your healthcare provider. They will be able to determine if midazolam is the right medication for you and provide appropriate guidance and monitoring. Remember, midazolam should only be administered by trained healthcare professionals who are experienced in its use. Follow the prescribed dosage and precautions to ensure a safe and effective outcome. In conclusion, Midazolam is a valuable medication that has revolutionized the field of sedation and anesthesia. Its benefits in terms of rapid onset, short duration, and versatility in administration methods make it an essential tool in medical practice. By understanding its common uses, advantages, potential side effects, dosage guidelines, and associated risks, you can make informed decisions and have a comprehensive understanding of this medication.